Hello and happy Teach Me Tuesday. My name is Lisa Houston and I am a NICU clinical nurse educator. Today I am here to talk to you about Breastfeeding Awareness Month. As you know, during the month of August, we have kind of been revamping previous Teach Me Tuesdays with our newest evidence, our newest information as we celebrate the 1-year anniversary of Houston We Have A, which is on Instagram, YouTube, and TikTok. Today, we are kind of bringing in a little bit of pieces to help show why breastfeeding awareness is so important, because it's not just about breastfeeding, but the breast milk that is provided and how that can help our babies in the NICU with NEC, their oral feeding readiness, and how Kangaroo care loops into all of that. So we're just going to update a little bit of each of those topics and pull it all together with breastfeeding awareness. So during the month of August is World Breastfeeding Month. So we're really talking about everything that is so important to breastfeeding worldwide. I participated a few years ago, oh gosh, maybe even 7-10 years ago at this point, in some information about what NICUs were doing in African countries. And it's so interesting with their feeding, what they are doing, how they are having moms express the milk, the spoon feeding, even for small babies like 31 weekers, spoon feeding it in, dripping it in, kind of being there as their constant source, almost like a feeding tube. It is so fascinating. But breastfeeding is so important all over the world. But in the NICU, it's one of those things that we can do so much with so little. We talk about how breast milk is liquid gold. In many NICUs, we talk about how breast milk is medicine, that we are giving it as kind of this preventative medicine to help build up their immune system, prevent things like NEC from happening, even give them more antibodies so that maybe another secondary infection isn't going to occur. We know from the CDC's report in 2022 that the rates of the breast milk use in the U.S., this is from all live births, so it's not specific to the NICU, but if you can imagine that only 84% of babies born in the United States are ever breastfed. By 6 months of age, only 56% are still breastfeeding. If you take that into the NICU and think about how many babies that you know are actually leaving the hospital breastfeeding or on breast milk, and if you don't know this, your NICU can probably track this. So if you're using an electronic health record, an EMR, an EHR, such as Epic or Cerner, they are probably tracking this, so you can ask for your data if you haven't seen it. But by 12 months, it's dropping to 35%. And exclusive breastfeeding at 6 months of age is only a quarter of infants born in the United States. So something to think about, ways that we can kind of increase our awareness to this, thing that we have available that we can help moms with. So it's so important in the NICU because of its nutritional value, immune properties, it's increasing the bonding, working on pumping and skin to skin is huge for our moms in the NICU. And this, we want to set them up for success. Of course, we believe that fed is best, and we would never pressure a mother into providing milk that she is not interested in providing. It's just making sure we've given them the proper education and information that they need, especially now that they're babies in the NICU. Maybe they didn't plan to breastfeed, but maybe they're willing to provide breast milk for their NICU baby. So it's really important to kind of distinguish those two things. Sometimes people are like, oh my gosh, we're forcing this on all people. We're not forcing it. We're just here to make sure that they're making informed decision making. And that's when we can come to some of these benefits. So breast milk has vital nutrients, and it's really important with these fatty acids, the proteins, and the nutrients. Breast milk is essentially water, right? It's more than 75% water. We all know that. That's how they stay hydrated. It's why you don't need to give a baby water, right? They get it from their breast milk. It has this fatty acid in it. It has the protein that's going to help them lay those new neurons that their body's developing since it's not in utero anymore. It has immune properties such as antibodies and immunoglobulins that protect the infant from infections. So important for all NICU babies. And there is evidence out there that breast milk has been associated with better outcomes for NICU babies, including shorter hospital stays, improved brain development, and reduced readmission rates. And that's important to remember as to part of why we give donor milk to some of our smallest babies. And that has to do a lot with this idea of the benefit of breast milk over the theoretical risk that something could be going on with a donor, and really why we push the importance of donor milk for our smallest patients. So how can we increase supply? Kangaroo care. So we did a whole Teach Me Tuesday on kangaroo care. Go back, watch that video, see the slides on Instagram. But really, we know that kangaroo care is not just for bonding. It increases milk production. It helps with the microbiome development. So while the baby's on the mom, they are kind of licking and rooting and moving around, and they're getting some of their mom's protective probiotics, skin flora, everything into their system already, which is going to improve their feeding tolerance. Of course, kangaroo care is going to increase comfort and bonding between the mom and the baby, but it can lead, this 2017 meta-analysis shows us that it can lead to earlier initiation and longer breastfeeding duration. So I have an extra slide that we don't have on Instagram. So if you're here watching on YouTube, hopefully you're seeing this, but this is from the Journal of Human Lactation, also like shout out to all these amazing journals that exist. And that just said that preterm infants who perform kangaroo care for at least 1 hour daily had higher milk production compared to mothers who did not. 1 hour. Now, in my opinion, your goal for kangaroo care should be far more than 1 hour. And really, in the previous Teach Me Tuesday, we talked about how there aren't really drawbacks to kangaroo care. There shouldn't be a reason to say you cannot do kangaroo care. Cooling, that would be one reason, therapeutic hypothermia, maybe chest tubes or umbilical lines, but really the benefits do outweigh the risk. And so this is just a compilation of 5 studies that have been published in the last 5 years that really say to us, you know, here is some great information on breastfeeding and kangaroo care. So we have in this meta-analysis that showed that kangaroo care was associated with higher breastfeeding rates and longer breastfeeding duration, enhanced milk production. If we keep kind of going through here, increased prolactin and oxytocin levels, more frequent breastfeeding, improved infant weight gain. So breastfeeding and kangaroo care. The kangaroo care is what is impacting the rates of breastfeeding. So you might think to yourself, oh my gosh, this 24-weeker weighs 550 grams. How is getting him out going to impact him long term? Well, if it increases our milk production and then gets him to breast earlier and more often and with better growth outcomes down the road, all positives. So the benefits of breast milk and feeding. So really this is specific to the NICU. Now, we know breast milk is great, but why is it so important in the NICU? It reduces the risk of NEC. We all know that that's a good thing to get rid of, which we're going to talk about. Increases emotional bonding. I've heard moms, even of term babies whose babies in the NICU, but specifically, you don't go into the hospital and have a baby and think you're going to leave the hospital and the baby's still going to be there. So how can we increase this bonding is really saying, like, let's get some of this breastfeeding going. Let's get breast milk production going. Let's get you pumping, looking at pictures of your baby. And then we've seen, you know, that breast milk has associated with better outcomes for NICU babies. So shorter hospital stays. Thinking about those readmission rates is so important too, because prolonged exposure to breast milk is going to continue to increase their immune systems and say, like, hey, we can protect the baby from some of this. So let's talk about NEC prevention. I do have this slide. I don't know how easy it is for you to see, but you can pause me and zoom in, or go to Instagram and zoom in. This is from a research article that talked about what's going on when a baby's breastfeeding versus formula feeding, or be given breast milk versus formula. And it really talks about the importance of this maintaining homeostasis in the gut. And so that's kind of what we're seeing here. We're not having any cell death. There's a higher risk with formula for all of those things. So if we think about what breast milk has, it's so important for NEC production, is it's rich in prebiotics. So that's your oligosaccharides. They act as prebiotics. They promote the growth of good bacteria. It has anti-inflammatory properties such as lactoferrin, immunoglobulin, so it's going to reduce the inflammation in the gut. So that's saying, like, the gut is going to be more stable and have less inflammation, because inflammation can cause just cell rupture. And then it has protective bacteria. So that good bacteria we're talking about, the normal flora, the flora that we want to get into the baby. So it has that live bacteria, and that's going to contribute to that healthy microbiome. If you go back to one of our NEC lectures and kangaroo care, There's a whole thing about kangaroo care and neck prevention. It talks so much about the microbiome, and there's fun pictures in there. So go check that out if you haven't already. Let's talk about breastfeeding and oral feeding pathways. So we've talked about the path to oral feeding in regards to how can we get babies eating towards discharge. So this is specifically from Johns Hopkins. This is their oral feeding pathways for breast milk. We also have some, and every unit I've worked on actually, is how can we get more babies breastfeeding before we go home? So the first thing that we have to assess is their mother's supply enough for the baby? And if we're at this point, that means we've already done our hard work to get her to the place where she's been able to have a sustained breast milk supply throughout the baby's stay. So if we did our due diligence at the beginning, where we were doing kangaroo care, having lactation appointments, making sure we have the right flange size, all of those things, then we can get to this place where we have enough milk to be able to do breastfeeding. So we're going to transition to home. We're going to get some PO feedings going. We might be doing some test weights. We might just be watching the baby's daily weight gain. So I would say that those are the two things I've seen the most is like, hey, are we going to do some test weights and make sure that every feed they're getting this minimum that they need? Or can we just watch over time and say the baby's continuing to gain weight while breastfeeding? So if the mom is going to provide breast milk exclusively but not breastfeed, we could fortify the feeds. This is one thing that's really important for our preterm infants. I'm like turning myself around here, but is that they likely cannot fully breastfeed, especially the younger you're born, because they're going to need some of those extra calories, extra iron, extra protein that we get that can be added in via formula. So we'll talk about how we kind of minimize that. But if a mom is interested in directly breastfeeding and the supply is less, then we can just even it out with some formula, right? Give some formula feeds and have some breastfeeds. And if they, want to primarily formula feed, then we're going to support them with that. But this idea that we have to have formula, or we like to call it the sprinkling. So you're adding some powder into breast milk to get it to the right calorie content is kind of an old school way of doing it. And if your unit's still doing that, great, but maybe it's one of the things that you could bring up. If you're doing that, it really limits how often the baby can breastfeed. So when we're talking about breastfeeding at discharge, first the baby has had to do their thing that we all know, suck, swallow, and breathe. The thing that seems to take them forever, right? They need to do that safely without aspiration. They need to have a strong and efficient suck so that they can have effective milk extraction. Nipple shields, a great tool for some babies that might need that to help them get through this. But for many NICU babies, especially our ELBWs, our smallest babies, they're going to need extra nutritional support. So what the current evidence is telling us is like, hey, instead of sprinkling some of this dry formula into your breast milk and having it so the baby is getting breast milk but isn't breastfeeding, if your goal is to breastfeed, let's just divide this up and do breastfeeding sessions 6 times a day, and the 2 times a day we'll give you some higher calorie formula so that we don't have to do it as often. What the research says is the babies actually grow better, because with the sprinkling of dry powdered formula into breast milk, it's not always consistent. It doesn't always supply exactly what the baby needs, and it takes away that bonding and what the mom and baby are experiencing. So if possible, we would think the baby eats 8 times a day. We could do 6 and 2, depending on your baby's growth and their lab. So if they have osteopenia, if they are having growth issues, if they're not on the growth chart yet, metabolic bone disease, if their ALK phos is really high, ALK phos is a relation of your metabolic bone disease, then we need to make sure that we're giving them some feed. So it could be a 6 and 2 or a 5 and 3 ratio. Those are the most common things I have seen. And it's usually either 22 cal or 24 cal. And it's going to depend. This is when you rely on your lovely dietitians that are going to help you so much, and hopefully you have some in your NICU or someone you can consult to help you kind of navigate what is this baby going to need. And then babies that go home exclusively breastfeeding are going to need extensive follow-up for weight gain, and that's what's going to help them be successful long term. Some get home appointments as part of their discharge readiness, and so that's great too. But the pediatrician is going to be a great resource for this. The pediatrician is also going to be the one watching the growth, the head circumference, and the length to say, hey, we don't really need these breast feeds and formula feeds anymore. You can just go ahead and be straight breastfeeding. So what do we need to tell our parents? Again, we're not here to say you breastfeed and provide breast milk or you're out, right? No, we say let's give them the best information and let them make a decision with a full stack of cards that tells them what exactly is going to do. So educate on the nutritional and immunological importance of breast milk, emphasize the need of regular pumping, so that's going to be every 2 to 3 hours. I know whenever moms say to me like, oh my gosh, it's so difficult to pump that much. I understand. I was a pumping mom. I had very low breast milk. That's just what my body did. And I had to pump after every feed to try to increase my supply, and it was exhausting. But for moms whose babies are in the NICU and they're saying, hey, pumping every 2 or 3 hours is exhausting, I just kind of say to them, like, we're training your body for when your baby goes home. If your goal is to breastfeed at home, your baby is going to eat every 2 to 3 hours. So we're getting your supply into this cadence of what they're going to need to do at home. So we also are going to get them onto Kangaroo care, which we just discussed the importance of that. We're going to get some help with our lactation consultants. Many NICUs have lactation specifically for their NICU, but if not, on mom baby, to come in and help teach about hunger cues, proper latch, etc. Provide reassurance about common challenges like milk supply and alternative feeding methods. So we mentioned one already, and that's the nipple shield if the baby's having a hard time latching, if mom has inverted nipples, whatever it might be. Another option is to do some SNS or supplemental nursing system. There are products out there by Medela. What's the purple company? The purple, everything's purple. It's not going to come to me. BD maybe. They have supplemental nursing systems, which essentially you've got your pumped breast milk or formula in a bottle, and a tube is attached close to your nipple, and the baby pulls it out with it. That's how I had to feed my babies. It worked gloriously. I love SNS. I do not think we use it enough in the NICU, so ask your lactation consultant about it. And then acknowledge the emotional impact of having a baby in the NICU, how difficult this can be. Celebrate those milestones, and then help make the plan for breastfeeding after discharge. The worst thing I've heard in my career, and this is like in my career, so not one day, not 2 days, I've heard it many times, is that the baby's ready for discharge and the mom's never put the baby to breast, but yet her goal is to breastfeed at home. We're not setting anyone up for success when we do that. So now during World Breastfeeding Awareness Month, I really encourage you to say to your moms, and those babies are turning 32, 33 weeks, what is your goal for feeding at home? For your pumping mamas, if their goal is to breastfeed at home, we should be doing a protected breastfeeding window. We should have a time where the baby can exclusively breastfeed. Many units do that. I found 3 different algorithms on that during my search for this presentation, where it's like, we're going to just do straight up breastfeeding for 1, 2, 3 days that the mom can be there and to watch the baby's cues. And then maybe we introduce the bottle as needed, but giving them the opportunity to get that bonding in and really figure out how they're going to work together, mom and baby, to provide that milk and to get the milk in. And then we say, okay, if your goal is, you're going back to work, that your supply is low and you're not going to be able to exclusively breastfeed, well, let's still breastfeed every time you're here, and then we can offer the bottle on the times you're not here. How can we make this easiest for your transition home? Because at the end of the day, we have to remember that we are not going to be there. And we also don't get to decide what's going to be easiest for their family. They need to decide that for themselves. And we want to help the mom achieve her goal. If her goal is to exclusively breastfeed at home, what can we do to support you? And we need to start early and often, just like discharge teaching. So we know that breast milk and breastfeeding in the NICU provide critical nutrition benefits, protection benefits, preventing of infections. We know that Kangaroo care is going to promote the release of oxytocin. We know that regular pumping, and especially when we can't breastfeed, and help from lactation consultants, getting the baby skin to skin, are all going to help the mom can maintain her supply. We need to talk about those alternative feeding methods, recognize hunger cues, look at skin to skin, and just to really reiterate the evidence behind the importance of breastfeeding and sustained breastfeeding for long-term health and development. So, thank you for joining me on this Teach Me Tuesday. I hope you enjoyed this dive into breastfeeding and how it's kind of related into past Teach Me Tuesdays that we've done. Please let me know if you have any questions, comments, or concerns. I do watch for comments on these videos, or you can reach out to me here on YouTube or find me on Instagram. My handle is down at the bottom, at HoustonWeHaveA with underscores, and I hope to hear from you. And I can't wait for you to join us next week for another Teach Me Tuesday. Have a great day.